Hi, my name is Melanie, and I'm a clinical pharmacist in Allegheny Health Network. Today we're going to talk about how to use the Humulin R U500 insulin pen. Humulin R U500 is a concentrated regular insulin. It is used to treat diabetes and specifically recommended for patients requiring more than 200 units of insulin per day. The pen dials in increments of 5 units. It can give a maximum of 300 units. There are 1,500 units in each pen. That is 500 units per milliliter and 3 milliliters in one pen. It is given subcutaneously or under the skin. It is given 2 to 3 times per day, 30 minutes prior to meals. The Quickpen contains a dose window, a dial, an injection button to inject the insulin. This button is harder to press and is a slightly slower injection compared to other pens. It also has a pen cap, which can be removed to see the insulin. The insulin should be clear and colorless. This should be checked before each dose. You will also need a pen needle and an alcohol swab. When you're ready to administer, wash your hands. Then remove the cap from the pen. Swab the rubber seal of the pen with an alcohol swab. Next, remove the paper seal from the pen needle. Next, twist the pen needle onto the pen until you feel some resistance. Next, you'll remove the outer cap and save it for later. The inner cap can be removed and thrown away. Before each dose, it's important to prime the pen to ensure that you get the entire dose and that the pen is working properly. To do this, you'll dial up to 5 units. You'll see 5 in the dosing window. Hold the needle over a paper towel or a trash can, or hold it with the needle facing up. Tap on the side of the pen to ensure the air bubbles rise to the top. Press the button down to push the insulin into the needle and out of the pen. You need to make sure that you see the insulin coming out of the needle to know that the needle is primed. You may need to repeat this step until you see the insulin coming out of the tip of the pen. Now you're ready to inject. Swab the injection site with an alcohol swab. Next, dial up to your prescribed dose. Inject the pen at a right angle to the injection site. It needs to be flush against your skin. Press the button to inject the dose. As you press, the dial should go back down to 0. After you inject the entire dose, leave the needle inserted for 5 seconds. After 5 seconds, pull the needle straight out. Don't rub the injection area. Next, put the outer cap back on the needle and pull the needle off the pen. Dispose of the needle in a sharps container. Never use needles more than once. Recap the pen and store it in a safe place prior to next use. The pen dials in increments of 5 units. It won't dial to a dose that is more than what is left in the pen. Your dose is adjusted by your provider for optimal blood glucose control. Most common side effects are hypoglycemia or low blood sugar. You may feel dizzy, shaky, or sweaty. If you miss a dose, call your doctor for instructions. Never double up on your doses. The pen should be stored in a refrigerator, not in a freezer, prior to use. You can't remove it from the refrigerator for 1 to 2 hours before injecting for a more comfortable injection. Open pens can be stored at room temperature for up to 28 days.